Assalamu alaikum wa rahmatullahi wa barakatuh. Today is part 4 for laboratory scientist and technologist license exam. First question, what is MCV unit? We should know MCV is one of blood indices, and MCV is stand for mean corpuscular volume. So MCV, it is the measure of RBC's size. The unit of MCV is femto liter, abbreviated FL. The normal value for MCV is between 80 to 100 femtoliter. If MCV is less than 80, then we call RBCs are microcytic. And if MCV more than 100, then RBCs called macrocytic. For microcytic RBCs is caused by iron deficiency, while macrocytic RBCs is caused by folate or B12 deficiency or chemotherapy. Question number 2. What are MCH and MCHC units? Also, MCH and MCHC is one of the blood indices like the MCV. And MCH, it is stand for mean corpuscular hemoglobin, and MCH, it is the measure of hemoglobin of RBCs. MCH normal, MCH normal is between 27 to 31 picogram. Abbreviation is PG. Low MCH is caused by iron deficiency. High MCH is caused by B12 folate deficiency. For MCHC, MCHC is stand for mean corpuscular hemoglobin concentration, and the normal value is between 32 to 36 gram deciliter or 320 360 gram per liter. Hypochromic is the low MCHC. Hyperchromic is the high MCHC. Hypochromic seen in anemia. Hyperchromic seen in spherocytosis. Question number 3. What are reticulocytes? Reticulocytes are immature RBCs and normal value in blood for adult range between 0.5 to 2.5%, and in infant between 2% to 6%. High retics count is caused by hemolytic anemia or erythroplastosis fetalis. It is due to kidney disease, which release more erythropoietin hormone, which is responsible for RBC's production. Question number 4. What are the stains used in the blood film preparation? Leishman stain, Wright stain, Wright James stain. All these stains are used in blood film preparation. Question number 5. Large size RBCs called and indicate what diseases? As we mentioned before, large size of RBCs are called macrocytes, which is more than 100, and indicate to what disease? Maybe B12, folic acid, liver disease, or consumption of alcohol. Question number 6. What is the pre-analytical phase and what errors may be included? The pre-analytical phase is include all errors that occur before the sample tested by the machine. This means it is from the time of sample collection to the time starting processing the sample. And the most common errors include hemolysis sample, clotted sample, mislabeled sample, or unlabeled samples, overfilled or underfilled tubes, incorrect container, leakage of the sample. All these are errors can be included in the pre-analytical phase. Question number 7. What are cardiac profile tests? Cardiac profile, it is the test to assess the heart condition, which may include lactate dehydrogenase, CKMB, troponin I or T, AST, cholesterol, and myoglobin. All these are cardiac profile tests. Question number 8. What laboratory tests may be used to monitor blood glucose levels? Fasting blood sugar, postprandial blood sugar, hemoglobin A1C for 3 months monitor, glucose tolerance test mostly for pregnant ladies. Question number 9. What is the difference between E. coli and Proteus? It is Proteus vulgaris. Both are from Enterobacteriaceae family. Both are gram-negative bacilli. But E. coli is lactose fermenter, while Proteus it is non-lactose fermenter. E. coli colony morphology is smooth or rough red colonies, while Proteus it is flagellated bacilli and show swarming on the culture plate. Question number 10. What is Streptococcus pneumonia? Streptococcus pneumonia is gram-positive cocci occur in pairs and cause pneumonia, which is dangerous disease for elderly people or immunocompromised patient. Question number 11. Define anisocytosis. Anisocytosis is varying. Question number 11. Define anisocytosis. It is unequal or different size of RBCs So you will find small, big, and small, moderate, big. So different sizes of the RBCs. Question number 12. Define picocytosis, which is different shapes of RBCs like teardrop and fragments. Question number 13. What does it mean that both MCV and MCH are low? This means iron deficiency, anemia. Question number 14. What is the reticulocyte stain and the type of sample? Type of sample is Edita tube. Reticulocyte stains, there is methylene blue, which is commonly used, أو methyl cresol blue. Question number 15. What is the difference between fasting blood sugar and hemoglobin A1C? Fasting blood sugar, you need to collect fluoride tube, or also plain tube can be used. But in case of plain tube, you need test immediately after separating the serum. For fluoride tube is better to use because it is inhibit the glycolysis. So the glucose level will be stable. While here in plain tube, if you left the plain tube without centrifugation or there is no gel separator, the glycolysis will decrease the level of glucose 7% per hour. For hemoglobin A1C, we are using Edita tube. Fasting blood sugar, it is measure the glucose at the time of collection. And you need fasting for 8 to 10 hours. For hemoglobin A1C, it is test the average of glucose on last 120 days, or means 3 months back. So we need to monitor if your medication is effective and you are controlling your blood sugar. We need to check the hemoglobin A1C. Question number 16. Why is the alkaline phosphatase normal level is higher in children than adults? Because in children it is a time for growth and development. Bone growing needs more alkaline phosphatase than adult. Question number 17. How is urine culture done? Mention all steps. First step, collect in a sterile container. At least 2 ml for culture. Mix the urine well before inoculation. You can use clad plates or blood, agar, and McConkey to cover here gram negative bacteria, and here it is enriched agar, so it will cover both gram negative and gram positive. Incubate plates for 24 hours and check for growth. If growth detected, check it is significant. So identify the bacteria and do antibiotic panel sensitivity. If no growth after 24 hours, incubate more to 48 hours and check again. If you notice any colonies, you will identify if it is significant or not. If it is significant, you will identify the type of bacteria and you will do sensitivity test. If it's still no growth, you will report no growth for urine culture. Question number 18. What is the difference between accuracy and precision? Accuracy. Accuracy, it is how close the measurement to the true value. So accuracy, it is measuring how our result is close to the true value, while precision is how close the results of the test if repeated 2 times. This means if you repeat a test 2 times on the same machine, how they are close to each other. This the precision. So they are completely different, and they are used in the validation of the new machines or method. It is a part of validation. Question number 19. Define the analytical measurement range. The analytical measurement range, it is the range of the analyte value that method can measure directly without pre-treatment, like dilution or concentration. This means it is the range that you will get direct result for the analyte without diluting or concentrating. So you will not get more than 10, for example, or less than 10. You will get exact value. And this analytical measurement also, it is a part of validation. Thank you and good luck. Please share and like and follow. Assalamu alaikum wa rahmatullahi wa barakatuh.